Well, hello everybody and welcome to the City of Paramount. My name is Brenda Olmos and I'm happy to be representing the city today with two very important people, which is Governor Newsom and of course our Supervisor Hahn, who represents our district. Governor Newsom, on behalf of my fellow city council members and the entire Paramount community, let me say how thrilled and flattered we are to have you visit our city today. Paramount has been known for teamwork and partnership. We have faced our share of adversity over years and have always pulled together, involving every facet of our community. This has definitely been the case during the pandemic, which such an overwhelming foe as COVID has been, our alliances have expanded. I want to profoundly thank you and the state of California for all the help that you have provided our residents and businesses. This has included rent and mortgage relief, eviction protections, the vaccination clinics, and test sites like the one we're all at today. This site has been a fixture in Paramount Park for quite some time now. In fact, we were the first city in Los Angeles County to host a mobile COVID testing bus and have coordinated ongoing COVID tests at now 2 of our parks in the city. I'm proud to say that the city of Paramount has been quick to act during the pandemic. We've conducted mass vaccination events with Cal OES and FEMA and mobile vaccine clinics with the county at 4 city parks and special events. And just a couple of weeks ago, we distributed over 1,500 free COVID at-home test kits to our residents in a matter of days. All throughout, the efforts of the state have provided invaluable support for the work we have all been doing. When this latest surge began, the city, the county, and the state all recognized the need for extra hours and extra support. And it all happened very quickly, especially here in the city of Paramount. Governor, I know that you are committed to continuing those efforts, and in fact, you're committed to expanding those as well. Just the fact that you're here today to share your plans is very humbling and gratifying to the residents of Paramount. Thank you again and welcome to Paramount. Now, I'd like to introduce my very good friend and a very good friend to our city, Los Angeles County Supervisor Janice Hahn.
Thank you, Mayor Brenda Olmos, one of the great leaders, mayors in our cities here in LA County. Thank you for hosting us today in your city, and thank you, Governor Newsom, for being here today, but also for your decisive leadership during this recent pandemic. Last year, we in the County of Los Angeles had the monumental challenge of getting as many of our 10 million LA County residents vaccinated as quickly as possible. And with the leadership and support of the governor, our partners in the federal government, and our healthcare providers, we were able to meet that moment and get people not only vaccinated, but boosted. It was hard work, but that coordination last year is paying off now. And we know it's during this unprecedented surge. But Omicron has presented new challenges for our schools, for our hospitals, and for our testing system. We're right now conducting over 200,000 tests per day, and it's amazing, but that still is not enough to meet the current demand. People want to get tested. They want to be tested to protect their families, themselves, their kids going back to school. It's time that we step up again and meet the moment on testing, just like we met the moment on vaccines. That's why I really want to applaud the governor's new emergency response funding package, which includes funding to not only expand the testing capacity of state sites like this one here in Paramount, but also to distribute millions of those rapid tests to schools so we can keep our kids and our teachers safe in their classrooms. And LA County needs to step up. I'm urging the county to set up testing locations at existing county facilities like our 89 libraries so that we can get these sites up and running quickly. People know where their library is, and I think that's a good move for us in the county. Then it's an all hands on deck moment, and I know we're also going to meet this moment as well. I'm now going to introduce the great governor of the state of California. Thank you again, Governor, for your leadership during the pandemic. Now, as we try to get these testing sites up, thank you for being here, Newsom.
Thank you, Supervisor. I want to thank Supervisor Hahn. I want to thank Mayor for the graciousness and their words. I want to thank them, more importantly, for their hard work and their leadership and their stewardship during this particularly challenging fourth wave of this pandemic. I want to first acknowledge all of the hard work that you see going on behind me, most of it on the other side of the bus. This bus represents, as the supervisor mentioned, one of 50 mobile sites that we've set up throughout the state of California, what are referred to as the OptumServe sites. These OptumServe sites not only serve the needs of residents in Paramount and LA County, but residents all across the state of California. Roughly 650 or so folks were served just yesterday here at this site. It's open between the hours of 7 in the morning, 7 at night, 7 days a week. Recognizing the need to expand these hours of operation and expand access to the opportunity to get tested, we deployed recently the National Guard. You'll see a number of National Guards, men and women, behind me as well, assisting in this operation to make things more efficient and to make sure data is collected more effectively. We have distributed across the state of California to support these 50 sites 200 National Guardsmen and women. We have 80 more going out the rest of this week, and 80 represents the number of OptumServe sites that will also be set up as the number of total sites goes from 50 to 80 across the state. It's important to note, to the extent it matters, perhaps less so to people in more dense parts of the state like LA County, but rural and remote parts of California are also being served. And this is an important point that needs to be emphasized. 90% of the population in the nation's largest state, 90% of the population is within 30 miles or 30-minute rather drive of an OptumServe site. And while that's impressive, we recognize it's not good enough. Nor is the fact that there are lines appearing in sites like this all across the state. That said, I think it's important that you understand what this state has done in terms of testing. 6,288 sites. 6,288 sites are existing, or rather persist, and are providing access to testing in the state of California. That's roughly 31% of all of the national testing sites, at least as of a week or so ago. It's not insignificant. So it shows what's been done, but it also shows where the gaps remain. We don't want to see these lines. We don't want to see folks have to line up, particularly on this side of the bus, and those are walk-ins versus those that have appointments. And so we continue to provide more support to expand these sites, more personnel, more expertise, and more testing locations throughout the state of California, though, as Supervisor noted, than our public schools. It's interesting, and we're grateful that the President of the United States, the administration today, announced a goal nationwide of providing 10 million tests a month to our schools. 10 million a month for the country. And while that's impressive, I want to impress upon you that we just provided 10.9 million tests in the last 30 days just here in California for our public schools. And while that's impressive in many respects, it also gives you, I think, a perspective of what we are up against nationwide in terms of the scarcity, particularly of over-the-counter tests. The fact that California was able to do that is because we're California. It's because we spent the holidays, Dr. Galley and his team and our Office of Emergency Service, quite literally at warehouses, ports, airports, making sure that those tests actually arrived and weren't rerouted in other parts of the country. We, yes, competed against the federal government for those tests. That's not the way things should be this far into the pandemic. I'm not suggesting otherwise, but I am suggesting we are able to punch above our weight because we're California. In order to continue to punch above our weight and to address the waits and the lines at sites like this and all over the state of California, we recognize we have to do more. And today we want to lay out with a little more detail our $2.7 billion COVID plan that I introduced just 48 hours ago to the legislature. It includes early action, sense of urgency. When we introduce a budget, months of deliberation, give and take. We don't want to wait months. You can't wait another minute in line. Folks are frustrated. So we are working, not calling on, because our legislative leaders have been extraordinary, but we're working with our legislative leaders to calendar an early action of $1.4 billion, hundreds of millions of dollars for more staff, hundreds of millions of dollars more tests, hundreds of millions of dollars more for more sites to do the most important thing we continue to have work to do, and that's get boosted and to get vaccinated if indeed you have not gotten vaccinated. So we're here to highlight that early action, $1.4 billion of a $2.7 billion budgetary request, highlight the work that is being done, acknowledge the work that needs to be done and the gaps that need to be closed, and reinforce the need to continue to support the federal government's effort at scale to procure the hundreds of millions, no, billions of tests that are necessary to move us out of this phase and into a new phase. As we turn the page to a new phase, let me just the phase we're in briefly. This is going to be a challenging period. It is a challenging period for so many folks that we're hoping after what we experienced in the last few surges that we would not be experiencing yet another variant, particularly one that is so ubiquitous in our lives with the Omicron variant. And while it's absolutely true, you don't need to hear from me. You've heard from everybody else as it relates to the nature of this variant. We all know two things. One is that it is, we also know that it is less severe than previous variants. That said, the total number in the aggregate puts enormous pressure ultimately on our healthcare system. And that is demonstrated and demonstrable across this country, and not least of which here in California, particularly as it relates to staffing needs in our healthcare system. And that's why the state of California, over the course of the last many weeks, we're not reacting to this, we in many ways were anticipating this. We have brought in out-of-state contract staff, 2,363 contract staff that we brought into the state of California over the course of the last many weeks. 1,250 more that we'll be bringing in to help support our healthcare system and to support our healthcare workers. We are providing flexibility, which we provided in 2020 and 2021 to facilities as it relates to how they utilize that staff. And we recognize how weary those staff are. You have someone, a remarkable young woman, operating this site. She's a NICU, basically works in the ICU for kids. That's her real job. And she's here working to test because she's filling a need. And she put her head down and said, I'm exhausted. And if we kept talking, I would have started to break down a little bit. And her physiology said all you need to know. She didn't even need to share the words. We're just exhausted, emotionally, physically exhausted. We're all exhausted. Every single one of you are exhausted by this. And all I'm going to say is we're going to get through this. Just a few more weeks. You're starting to see not just parts of the globe, South Africa, the UK, but even parts of this country where we're starting to see in the last 3 or 4 days some case leveling. That's going to happen here in the state of California as well. And while we've outperformed other large states, let me be specific. If you lived in Florida, we would have roughly 40,000 more deaths if per capita death rate was equivalent here in California. We actually have 50% lower per capita death rate in the state of California, 35% lower than the state of Texas. We have a 50% lower positivity rate than that state, those states today. That's not to impress upon anything. I'm not impressed by any of that, except to say we continue to lean in. We're not shy. And we continue to try to lead across the spectrum of supports. But yes, we have more work to do. So on issues of the healthcare system, and finally, on the issue of schools, I recognize that we have challenges that we're facing in the next few weeks there as well. And that's why yesterday we put out an executive order allowing more flexibility for our public educators to bring in substitutes, more retirees, to allow the opportunity to help address the workforce constraints as well, because so many members of staff, our educators, paraprofessionals, not just teachers, are testing positive as well. We need to keep our kids in person instruction safely in school. That is our priority. It will continue to be. And the staffing flexibility EO I put out yesterday, executive order, we hope helps in that effort, as well as the number. And Dr. Galley, remind me, how many N95 masks we've sent to our schools? 9 million. This is important. 9 million, not cloth masks, not 900,000, not a million, 9 million. In the last few weeks, we've sent out to our public schools. We have a website Salesforce put up in the Office of Emergency Services on demand. We've done 1 billion units to cities, counties, school districts, and local health offices all across the state. 9 million specifically to public schools, N95s, in addition to the billions and billions of dollars to support their other efforts. So again, no one's trying to impress anybody here. I know how hard this is and how pressed we all are with the pressure that we're all experiencing, particularly parents out there. And I just want folks to know we're doing what we can. Credible leadership at the local level, partners at the state and federal level, here to assist, trying to be creative, trying to be flexible, and moving as conditions change in real time to adapt to those changing conditions. So with all of that, I'm here to answer any question. And if you're wondering why I'm dressed up for this occasion, we were down in San Diego cleaning up encampments. And that's a way of saying this: we can do many things at the same time. And don't think we're taking our eye off the ball around the most important and pressing issues in this state. But right now, the most important and pressing issue is getting this pandemic behind us once and for all. Happy to answer any questions.
Governor, why was it important to you to become why was it important for you to become this particular test at all the sites in the state?
Because I was here not too long ago with Speaker Rendon, and Speaker Rendon talked to me about the importance of not forgetting the visit, because the folks here need not only the visibility but the support. You look at the socioeconomics, you look at the demographics in this district, they're uniquely deserving of our time and attention. And so I wanted to fulfill the commitment I made to the Speaker. I want to acknowledge the work of the Mayor, and wanted to always acknowledge the good work and advocacy of Supervisor Hahn. Yeah, this also highlights areas where we have to do more. And that's what I'm specifically want to highlight as it relates to what we refer to as HPIs. That's where we lose everybody. And that's these Healthy Place Index. We were one of the first states, if not the first state, to put out an equity metric. In fact, we were, as it relates to our testing and vaccine sites. And we were very transparent about where we were weak and where we had strength. And so we are in an HPI that requires us, a quadrant in the state of California, to do more and supplement the testing and vaccination access. That's exactly why this mobile site was supposed to be moved and hasn't been moved, in order to fulfill that obligation to continue to do the job and continue to close those gaps, equity gaps in particular. Thank you.
Regarding universal health care, how it's funded, can you explain the difference between universal and the legislature's version of funding?
Yeah, well, there's a legislative proposal that has nothing to do with the universal health care program I put out. I've seen some reporting, and I want to hopefully make that crystal clear. Ours is funded, ours is budgeted, ours allows us to not only balance the budget this year, but to be able to balance the budget 3 years out. We are ready to move with a $614 million appropriation this year that will allow us to become the first state in the country to provide universal health access to all low-income Medi-Cal eligible Californians, regardless of pre-existing conditions, ability to pay, or their immigration status. We do it because it's the right thing to do. We do it because it's long overdue. We do it because politicians have been talking about this for decades. And we do it because it's cheaper to get everybody covered than to cover them on the back end in the emergency rooms and the emergency departments. So we use common sense and fiscal discipline to do the right thing, to keep families safer, communities healthier, and the economy moving.
So you're saying
No need to, in fact, we had significant tax cuts in this year's budget. We did the biggest tax rebate in American history, $12 billion last year. And we expect in the May revise language, when I update the budget in a few months, that we are likely to have an additional rebate to the taxpayers. No new taxes in our budget.
Thank you.
Governor Anthony Fauci today said that Omicron's going to find, we quote him, will ultimately find just about you.
Yeah, are you looking at me? Oh, sorry. Yeah.
So you've been at this for some time. I'd be interested in your gut.
Yeah.
You kind of made a reference to it. Viruses mutate so that they're less deadly but more transmissible. That's what's happened here. The Spanish flu became part of the background flu 100 years ago. So is it your gut that once February hits, we hit the peak, we start to slide down, that is the moment where this is going to tail off? And before you answer, could you look at my camera and not at me?
Oh yeah, where's your camera? It's nice to see you. So one thing I've learned is the things I regret most in my political professional life are when I answer from the gut, particularly when I have someone that can answer from not just the heart but the head, and his name is Dr. Galley, who's going to come up first, and then I'll respond to you in camera about my gut response. But first, let's have more of an intellectual response from Dr. Galley.
Yeah, thanks for the question. And as we've seen throughout this pandemic, each wave, each surge, we handle differently. This one has certainly been one where we have a variant that is so much more transmissible. Dr. Fauci, many others, right, we're going to see so many Californians infected by this virus. The good news is, because of our great success with vaccinations, even those who maybe have been infected before, the level, the severity of disease that we're seeing with this particular variant is a lot lower. Yes, some people are getting infected, many fewer are getting hospitalized, and certainly many fewer are dying. And our hope is that as we get through the next few weeks, people are exposed, people recover, people find out that they didn't have that many symptoms, that our baseline immunity to the COVID-19 virus and its variants that we have seen already and the ones that are yet to come will be strong enough to prevent such an immense overwhelm of people's health, the healthcare delivery system, and we start to move into a bit of a new normal. That said, and the governor has said this many times, humility has been the word of the last 2 years. We face this virus with a great deal of humility, a great deal of flexibility. It moves. We try to be prepared and sometimes have to react, and we will keep doing that no matter what it throws our way. But yes, we hope as we get to the tail end of this surge that future challenges with COVID and its variants will be more manageable for our state, and we can get into phases of a new normal.
Let me build on what Dr. Galley said, because I think it's illustrative of the challenges we're having with testing. There was gut feeling in this country that the testing wasn't necessarily needed. So a lot of the testing facilities or companies rather started reducing their supply and manufacturing rate, only to find out a few months later that all of that supply was needed. And so, look, critical to be prepared. When we came into this pandemic, we didn't have ventilators, we didn't have PPE, no one even knew what PPE meant. We have been able to push stockpiles all throughout the state, create redundancy in terms of our surveillance programs, our testing protocols. We want to build out some permanent infrastructure moving forward so that if our gut is wrong or the modeling is wrong, that we're prepared to move in real time as it relates to a new consciousness around infectious diseases. But my sense is, on the basis of the ubiquity and the fact that Dr. Fauci and others have suggested so many of us are likely to get this new variant, that we are in a different phase in a few months or a month in this pandemic. And that's why not only dealing with the crisis at hand, but we are doing exactly what Dr. Emanuel and others have suggested federally needs to be done, and that is preparing for not the pandemic phase of this reality, but the endemic phase of this reality and how we live with future variants. And that is being conducted, those efforts conducted in real time, and we'll be making public those detailed strategies over the course of the next many weeks.
So should the focus be, you focused on vaccinations, why not partner with people like Donald Trump, who said he got the vaccine, got boosted? He's actually condemned Republicans who refused to say whether they got boosted. I know you focused on vaccinations, but that seems to be most critical when it comes to Omicron.
Yeah, and that's
You've got red counties in this state with very low vaccination rates.
That's why I spend the vast majority of my time reminding people about getting boosted. That's why this early action has hundreds of millions of dollars for vaccines and boosters. In fact, the majority, or rather plurality of the funding in the $1.4 billion early action is for vaccines and boosters. There's still no more important thing we can do because it mitigates the side effects and the direct results of this variant, and obviously had more impact with previous variants, and I would assume more still into the future. So there's still no substitutes for vaccines, and I would note that 95% of Californians 18 and over, 95% now have received at least one vaccine dose. We have among the highest vaccine rates of large states in the country, but we still have work to do on boosters. Just 10.9 million boosters have been administered. It's only 51% of those eligible, and we have more work to do for those kids my age, 5 to 11, where we're outperforming the nation, which has a 17.2% average fully vaccinated population, 5 to 11. We're a little over 20%. We have more work to do in that space as well.
Thanks, Governor. Josh Haskell. Talked a lot about misinformation. There's 1.9 million LA County residents eligible to get vaccinated, still have not been vaccinated. We're seeing these lines for testing everywhere. We're not seeing the lines for boosters
Yeah.
and for vaccinations. So are you worried at all that in terms of misinformation, the damage is done? How do you break through that?
We just keep pounding, don't give up. We're averaging about 180,000 tests, or rather vaccine doses a day. Averaging 180,000 vaccine doses a day. We still have a lot more work to do. We continue to push back. We have a team of folks that work for Dr. Galley that quite literally day in and day out are battling out social media and online against that misinformation. So we're not just dialing that in, we're quite literally going toe to toe with those that are generating all of these falsehoods. I had folks out there saying that when I had my booster, I had some side effect. One guy offered me $5 million. Personally, if I can prove him wrong, I'm waiting for the $5 million. I'm happy to accept it and distribute every penny of it. You owe me $5 million. Just the rank wrote lies. A famous family member, was out there guaranteeing that, this nonsense they're spewing. Lies. They're just outright lies. And they're able to sell books and sell advertisement, sell their contracts to generate even more successful careers. And we'll just have to keep pushing back. I still do want that $5 million. Why don't you guys do a little investigative report on that? That's an interesting investigative report. They'll show you. I'm sure you call him. I'm not even kidding. We'll have some fun with this, and we can give the money away to charity together.
Governor Alex Michelson, Cox Lemon, how do you determine when the endemic begins? Because now, when you look at hospitalization rates, right, there's so many people that are hospitalized not because of COVID, but they get to the hospital and they find out that they have COVID and they won't be there anyways. Do you change now the metrics when it comes to hospitalization? And do you think that Omicron is the last bad big wave of
No, I'll repeat what Dr. Galley said. I told you guys, you all heard this so many times for good reason. You heard it, that my word of the year was humility. That was last year's word, and I'm starting out. That's top of my word list this year as well. We don't know what we don't know, except we're more prepared to move more quickly to address the nature of change. That said, look, the point you made around hospitalizations is important. What matters to me, the total number of people hospitalized, because of our capacity to address the needs of people across the panoply that have all kinds of related issues. Let me be specific. We are just 1,000 census away from peak hospitalizations compared to last year. We have just we have 51,400 or so? 52,400 that are hospitalized today. We will likely break last year's peak record in the next few days. That being said, you're correct. Less than 12,400 are hospitalized for COVID. 52,000 total hospital census, just 12,000 or so for COVID. At the end of the day, COVID or not, we have to support our healthcare delivery system. And the staff is overwhelmed, and we want to make sure there's access, particularly in the emergency departments, and ultimately to preventative care and acute care needs across the spectrum. So if nothing else, the after action on this pandemic is a reevaluation of our healthcare system as a nation and our capacity to flex and surge in real time. And that is going to be a stubborn and challenging issue, as it's been for decades. It's one of the reasons we're prioritizing universal health care as a foundational predicate to advancing that effort. But absolutely, the flexibility and designing a system for surges, regardless of this pandemic, future pandemics, is front and center in any endemic framework that ultimately we will advance. Yeah. Dr. Galley, we've been having so many conversations on this. Let me answer.
Tina said if they're in there for COVID, if they give different care, right?
Yeah.
If they're
Even if
not
they didn't
hospitalized
come in
because of COVID,
Yeah, but they do it as a
maybe
byproduct.
time to change the mask mandate or other COVID restrictions that people aren't going to the hospital because of COVID.
Well, there's a couple of things we have to really work through on this. But the bottom line is we have to make sure we have capacity in our hospital. We need care, whether it's COVID directly, indirectly because of COVID. I mean, we're already starting to see that higher than in the community number of patients are coming to the hospital, not with COVID respiratory disease, but potentially the impacts of COVID on other chronic diseases, whether that's diabetes or heart disease. So the long-term implications of COVID is something we absolutely need to think through. But right now, we're laser focused on making sure those hospitals, those staff that are weary, those staff that are tired, have the kind of support they need, and everything we can do as a community to make sure that capacity is there for people sick with COVID, for people in car accidents who need acute care, for people with strokes or diabetes or heart attacks. We need to do all that we can. So the day will come when we're going to have a different conversation, but right now, today, making sure that 52,400 admissions in the hospital doesn't keep increasing, making sure the staff that put their lives and families on the line every single day have all of our support and backing, I think is focused on right now.
Just remember, it's not just those that are in the hospitals with COVID, it's so many staff with COVID that can't go into work in the hospitals, and that's why masking is so important and vaccinations remain critical. Yeah. Yeah. That's right. Yeah. Yeah. We'll keep going. I mean, yeah, look, we got, I don't, maybe Omicron will wake folks up. I mean, there's not a one of us that doesn't know more than a handful of folks that have gotten COVID in the last few weeks. Maybe that will finally wake folks up. And remember, 4.5% of folks that get even Omicron end up in the hospitals. That's not an insignificant number when you look at the totality of people getting it. Their average length of stay is down to 3.6 days, but still, people are ending up in our hospitals. Our kids, our pediatric rates are twice what they were. There's over 1,000 families that can't hug their children over the holidays because they lost a child to this disease. And so I hope all those facts, including the efficacy of vaccines that most of those folks have taken when they were kids and are required of them as parents to keep their kids into public schools, would wake them up to the opportunity to get a free vaccine so you don't have to sit there with IVs to celebrate the fact you listen to podcasts and you're on monoclonal antibodies that are produced by the same pharmacies you claim to despise. It's a hell of a moment in this country. Forgive me, now I'm being kicked by my staff to ask. Oh, we're in a position where the resources aren't a problem today, so just don't think about it as a finite date where we run out of money and then we wait for new money. It's more of a continuation with an expectation. And so we expect early action on a number of items. And I'll just give you the top three to the extent you're interested. We have work to do on sick leave. We have work to do on rental protection. And we have work to do on early action related to this pandemic. And so that's top three priorities, three-legged stool that the Speaker and the Pro Tem are prioritizing over the course of the next number of weeks to figure out dates, time certain, so we can move.
Okay, but we need the expanded testing now.
And that's why we're doing it.
Okay, what I'm saying is, can you give us an idea of when we will see that from the commission?
It's happening in real time. I'll go back to what I said. We have 200 National Guards men and women here today, 80 more in the next few days, going from 50 sites to 80 sites, specifically, these kinds of sites, specific to this type site. We have hundreds of partnerships across the state and over 6,288 specific points where people can get access to either vaccines or testing in the state, 31% of the nation. So we'll continue to build on that. We're doing all of that in real time. That's just the view of the world. And then, of course, Janice and her team, they have county efforts and, of course, more localized efforts all across the state that happen every single day. And this money will just aid and advance those efforts, supply more confidence that when they move forward without confidence that they have the resources, that the state will be there to help backfill those resources. A lot of it is for reimbursement.
One more quick question out of here, Dr. Kelly. We're at the almost 72% of 5+ fully vaccinated. What's it going to take to get the herd immunity?
Yeah, he may want to run on the herd immunity question.
Yeah. So look, herd immunity is a concept we talked a lot about early with vaccines, and I think you haven't heard it talked about a lot recently because I think we're all humbled by the fact that we don't really know what it's going to take. With new variants every single month that we're investigating and looking at, trying to understand how they transmit, how serious they cause disease, how much they escape the immune system. The concept of herd immunity is one that frankly escapes us right now, but we are working hard to make sure that we get it, get people vaccinated as much as we can. And I would just say, last week, among the vaccines, we had 20% more people get first doses last week than we had the week before. So this notion that the people who aren't getting vaccinated are just never going to get vaccinated is a false narrative. People are. It's small numbers, it's really hard work, people are fighting the misinformation, but it still happens today. Today, somebody who decided for the last 13 months not to get vaccinated decided today was the day. And those Californians should be celebrated, and I hope they're an example to their neighbor or their friend or their family member who says maybe this is the day to do it too. So, it's hard work. This is public health. This is health, period. And we keep doing it, and we're hopeful that we're going to see more people vaccinated, not because there's some fancy number about herd immunity, but that individual protection is meaningful. It protects you, it protects your family, it protects your community, and make sure you're there to hug your loved ones and your loved ones get to hug you down the road.
Davis said today that there's no accountability when it comes to spending on the homelessness, and he termed it a homeless industrial complex. And he also said the homeless have been empowered to the point where they dictate where they live in the community rather than the other way around. So I wondered if you had any comments on that related to what he said in San Diego this morning.
Yeah, no. I will just say this. California did something novel last year. I was very proud to work with the big 13 mayors representing the largest cities in the state of California who supported this approach. We are requiring cities and counties, and what we refer to as CACs, to put out homeless accountability plans. Those plans need to be submitted to the state of California and go through a vetting through our interagency council to end homelessness and approved. Those plans are not only setting forth 6 demonstrable metrics for performance and outcomes, but also have a bonus component that the sheriff may not be aware of that provides upwards of 18% additional resources above baseline if you actually meet the stated goals. So there is a new framework around accountability, new planning metrics that include county sheriffs, and we look forward to submittal of the plans across the spectrum, and I look forward to the sheriff's detailed strategy on how best to use the resources that he's been provided as well.
The timeline on that.
It's required by mid part of this year. It was supposed to be a few weeks ago. For different reasons, it will be, has to be Friday. Likely to, don't tell anyone. Yeah, no, I can't lie. I don't want to mislead you.
Is there frustration that an idol of yours, Robert F. Kennedy, his son, is leading the campaign against vaccination?
No, not when the overwhelming majority of the family members feel completely differently than he does. I mean, that same individual was out there campaigning for what he thought was for California, and that was Larry Elder's candidacy for governor. He's also been directly misleading and lying to people about a number of things, including my own reaction or non-reaction to the booster. So with respect to that individual, he's not someone I follow day in and day out for counsel, advice, consultation, and the overwhelming majority of the Shriver and Kennedy family members are opposed to Mr. Sirhan's release. Thank you all very, very much.